Nicole Green. I'm the Acute Oncology and Cancer Unknown Primary CNS here in the L&D. PICC lines or peripherally inserted central catheters are in patients' arms and they sit in the superior vena cava. Patients will tell you that they've got a PICC line and they are quite precious about them because they usually have them because they've got poor venous access. So it is in everyone's interest if we use them within the A&E department. A, you've got instant venous access, and B, you do not have to try and cannulate someone with poor veins, and it really improves the patient's experience of their A&E visit. We can use the PICC lines to take bloods, to take blood cultures, and to give all of their IV fluids and antibiotics within the department.
This animation shows how a PICC line is put in. A PICC line is a long, thin, flexible tube which is inserted into one of the large veins of the arm, near the bend of the elbow. It's used to give intravenous fluids and medicines like chemotherapy and drugs such as antibiotics. It can also be used to take blood. Having a PICC line means you don't have to have repeated injections or needles. Once it's been put in, it can stay in for several weeks or months. It stays in until all your treatment is over. The PICC line is put in by a specialist nurse or doctor in hospital. First, the skin in the area is cleaned with antiseptic solution. Then, the area is numbed with an anaesthetic cream or injection. This is so you don't feel pain while the PICC line is being put in. When the skin is completely numb, a needle will be inserted into a large vein in your arm. This will be a vein that leads to your heart. The PICC line is threaded through the needle and into the vein. It is threaded through the vein towards the heart. The needle can then be removed, leaving the PICC line in place. This shouldn't take long and is usually painless. At the end of the PICC line, there is a needleless connector. The nurses will use this for everything they give you through your PICC line and for taking blood. The PICC line will be held securely in place by a see-through dressing. Having a PICC line put in shouldn't hurt because of the local anaesthetic, but it may be slightly uncomfortable and you may feel a bit of tugging. You will then have a chest x-ray to check that the end of the tube is in the correct position. Before you go home, the nurses will show you how to look after your PICC line. Most people don't have any serious problems with their PICC line, but problems can include a blockage or infection. To make sure the PICC line doesn't fall out by accident, it should always be covered with a dressing. If you have any questions about your PICC line, ask your doctor or nurse.
So differences with the Hickman line is it is in the patient's chest and not in their arm, and also they have a clamp on them where the PICC lines are unclamped. Apart from that, you can use them in exactly the same way. You can use them to take bloods, to take blood cultures, and to give all IV fluids and antibiotics. But please be mindful that the Hickman lines that we have in the Luton and Dunstable Hospital are double lumen, which means when you take blood cultures from them, you need to take blood cultures from each separate lumen. So that'd be 2 sets of blood cultures and 2 requests. And also please label which lumen is what when you're on the forms, because that helps us identify if there are any infections within the line.
This animation shows how a central line is put in. It's also sometimes called a skin-tunneled venous catheter. A central line is a thin, flexible tube that is placed in a vein close to your heart. It's used to give intravenous fluids and medicines like chemotherapy and drugs such as antibiotics. It can also be used to take blood. Having a central line means you don't have to have repeated injections or needles. It stays in until your treatment is over. The central line is put in by a specialist nurse or doctor in hospital. They clean the skin around your neck and chest with antiseptic and then inject local anaesthetic to numb the area. A general anaesthetic can sometimes be used. The central line goes in through a small cut in the skin near your collarbone. The tip of the line is gently threaded into a large vein towards the heart. The other end of the line is then tunnelled under the skin to reach the exit site. The exit site is the place where the tube comes out of your body. Having a line inserted shouldn't hurt because of the local anaesthetic, but it may be slightly uncomfortable and you may feel a bit of tugging. At the end of the central line, there is a needleless connector. The nurses will use this for everything they give you through your central line and for taking blood. After it's inserted, you'll have a chest x-ray to check that the line is in the right place. You will have dressings covering the entry and exit sites. Before you go home, the nurses will show you how to look after your central line. Most people don't have any serious problems with their central line, but problems can include a blockage or infection. If you have any questions about your central line, ask your doctor or nurse.
Okay, so Portacaths are a longer lasting line and they are internal to the patient. So Portacaths are a small disc that usually are found in the chest of a patient, but can be in any area within their body. A patient will tell you where their portacath is, and they also know how they need to lie or sit for it to be accessed, so they can really help you. Now, the main thing to be mindful of is that with portacaths, that they need to have a special needle to access them, and we do not use our generic needles and syringes on a portacath directly because it can damage them and lead to thrombosis. So what we need is a Huber gripper needle, which you do have some within the A&E department, or you can call us in acute oncology or the chemotherapy unit and we'll always happily provide you with the equipment needed. If you have a patient and you need to access their portacath, because usually these patients are those that have got metastatic cancers or have got bilateral breast cancers where we cannot use their arms for venous access, so the portacaths ideally are their best source of venous access. Obviously emergency situations are different, but we will always happily come and assist and teach you how to access the patient's portacaths within the emergency department. If you have a patient with a central venous access device and you need help to access them, please call us in acute oncology. If you feel that there are any complications to the central venous access devices, please contact the vascular access CNSs.
Bless you.